Hello, so my name is Matthew Constantine. I'm a second year PA student, and today I'm going to be presenting my portfolio. So as you can see, I have everything divided off into the appropriate folders, and we're just going to go in order, starting off with my biomedical ethics course project. So this project focused on Black maternal mortality in the United States and the structural and the ethical reforms that are, needed to address those issues. So, this artifact really helped me to understand that patient care is just more than about diagnosing and treating. You also have to be able to advocate for patients, right? You have to be able to listen to them and recognize the different structural barriers that are present and that often prevent them from getting the necessary care that they require. All right, so we're going to move on here to my biomedical ethics ethical argument essay. So this essay focused on an end-of-life care dilemma involving a patient who had advanced pancreatic cancer, and her husband opposed morphine use. So I explored the tension that was existing in this case, between beneficence, being able to relieve her suffering, and then relational autonomy, right, where the patient decisions are influenced by her family and the emotional relationships that she has. Overall, this helped me to think more carefully about dignity, goals of care, communication, and just keeping the patient's voice central despite being in these difficult clinical situations. All right. My next one is my evidence-based medicine mini-cat. So we focus on patient-controlled analgesia versus non-patient controlled analgesia in the setting of post-hip arthroplasty or replacement surgery. So we evaluated pain control, opioid use, patient satisfaction, recovery, length of stay, and the different side effects that are associated with this. And overall, this just helped me to see that evidence-based medicine is not always like a simple yes or no answer, and clinical decisions often require balancing benefits, risks, and mixed evidence. All right, so moving on, I'm going to discuss my health-related policy analysis. So what I proposed was an analysis that involved a tiered COVID-19 vaccine mandate for healthcare workers in New York State. So pretty much I compared a blanket mandate, which would require for everybody. I explored, employer discretion, and a tiered risk-based policy with testing, masking, education, and exemptions. So overall, this artifact helped me to understand how public health policy has to be able to balance patient safety, workforce stability, equity, trust, and feasibility. All right, so we're gonna move on, and we're gonna talk about now my HPDP case study. So my case study here focused on a 25-year-old man who had asthma. He had class 1 obesity and borderline elevated LDL. So for him, I was able to create a personalized, individualized plan that addressed his diet, exercise, his alcohol intake, and follow-ups. So this artifact helped me to practice, patient-centered counseling, and reminded me that, a sustainable lifestyle change requires realistic recommendations and being able to participate in shared decision making. Okay. So we're going to move on to my patient-centered interview video. So this is one of my earliest artifacts, showing my early development in clinical communication. And it just reminded me that, early on, especially, it's not all about just gathering the data. You have to be able to make the patient feel heard, make them feel respected. All right. My next one here is my public health intervention. So for this project, my group focused on diet, exercise, and education, and its ability to reduce the progression from prediabetes to type 2 diabetes in your adult population that are ages 30 to 50. So it helped me to think beyond just treating disease and focusing more on prevention, early intervention and patient education. As a future PA, to reinforce the importance of identifying risk factors early and, helping patients to make realistic and evidence-based lifestyle changes. Okay. So moving on, we're gonna look at my clinical correlations class. So here's my reflection. This class really helped me grow in terms of my clinical reasoning. They really challenged me to identify relevant details, be able to develop differentials and think through different management decisions. But one lesson that really stayed with me happened particularly in Professor Harrell's rotation, where he always, reiterated to us, will this result change your management? And from that, I've been able to shape how I think about labs, imaging, and diagnostic decisions. All right. So finally here, physical diagnosis 1 and 2. So in this class, I also grew a lot. As you can see, my first presentation here was about a patient with severe heart palpitations. And then my second one here was about another patient with some upper body pain, fever, and pus coming from his arms. So in physical diagnosis 1, what I remember is that I approached the HPI and the ROS more like a checklist, you know? It wasn't very tailored, it wasn't very focused. And by the time I got to physical diagnosis 2, my documentation definitely became a lot more deliberate, focused, and just more clinically organized, I would say. But overall, this artifact just shows my progression towards writing HPIs that tell, you know, more clear story and that really support my differentials. Okay, so now I'm going to transition into speaking about the clinical year, starting off with my first rotation, which was surgery. So had my first H&P here where I talked about a patient that was diagnosed with appendicitis, but it was a very abnormal presentation. And then she also had Behçet's disease, which I wasn't really familiar with, which kind of construed my thinking and made it a little bit harder for me to, you know, have a clear idea of what was going on with her. Another patient here, actually very memorable as well, came in with Fournier's gangrene. So that's a case I'll never forget as well. And then let's move on to my journal article here. So my journal article focused on bladder injury during laparoscopic appendectomy and, you know, different detection, management, and different learning points that are important to think about. So overall, just reinforced to me the importance of, you know, being careful with your surgical technique and, you know, the importance of bladder decompression before inserting those suprapubic ports. But yeah, overall surgery really helped me to understand perioperative care and the whole surgical workflow. So now moving on to rotation 2. So I had a first patient here, you know, very depressed patient, very suicidal. So that was a case I won't forget. So that was my H&P. Now let's look at my journal article. So what I talked about here was the different imaging markers that are associated, you know, with post-stroke depression and apathy. So it really just reinforced to me as well and helped me to understand that, you know, psychiatric symptoms can have neurologic and medical contributors, especially in the post-stroke setting. All right. But yeah, overall the rotation just really enforced to me, you know, the importance of empathy, safety assessment, and just being holistic in terms of your patient care. Now moving on to family medicine. Here's my first H&P where I discussed a patient with chest pain, and it ended up just being costochondritis. You know, but this rotation really exposed me to outpatient care, you know, preventative management, and looking at my journal article. So I chose to focus on, you know, what are the clinical outcomes associated with sickle cell trait, because that patient with the costochondritis actually had sickle cell trait. So I was wondering, you know, if there's any potential for sickle cell trait to manifest with like cardiac complications. And what I ended up learning is that sickle cell trait is usually benign, but it can be associated with complications such as PE, you know, proteinuria, and CKD. So overall, this rotation really helped me to balance risk awareness and, you know, just being able to focus on practical clinical judgment. All right, now we're going to move on to our PICOs. So my PICOs really reflect my growth in terms of evidence-based medicine, you know, and critical thinking. So, you know, these assignments each taught me how to take clinical uncertainty and just turn it into a focused clinical question and, you know, identify whether a question was about screening, diagnosis, treatment, and I also learned how to evaluate, you know, different study designs. But most importantly, I feel like the PICO processes taught me to ask whether the evidence would actually change management. So, you know, overall, I feel like I'm learning little by little to be able to combine research, you know, my clinical judgment, and just patient-specific factors to guide care. All right, and then here's a table that's discussing all the different questions that I've come up with so far. All right, so, you know, those are all my artifacts up to this point, and if I were to present this to a potential employer, I would describe it as an evidence of my growth from being a didactic learner now into the clinical learning phase, and it just shows my development in terms of patient-centered care, and also reflects my commitment to being a lifelong learner as I, you know, work towards being a future PA. So overall, this portfolio really just reflects my progress so far in PA school and my continued development toward becoming a competent and evidence-based clinician. So thank you for viewing my presentation.